flu season already causing Ohioans concern, especially as we get ready to gather with family this holiday season. And I'm here with Dr. Peter Kambelos, Medical Director from Buckeye Health Plan, to give us tips to better protect ourselves, our family, and to get some answers to some of the questions that people have about the flu right now. Thank you so much for being here.
Pleasure to be with you.
Awesome. Okay. First, can you tell us the kinds of things that we're seeing this season? We're here, it's really a hodgepodge of things.
Well, first and foremost, I'll say this. We are on track to have an influenza season probably equal to or greater than what we've seen pre-pandemic. We're seeing a lot of influenza out there. So nationwide, there probably have been about 15 million cases so far this season, over 150,000 hospitalizations, and sadly over 9,000 deaths, and many of those have been, unfortunately, children. In fact, in northern Kentucky, in the state of Kentucky, there have been probably on the order of 6 pediatric deaths, and from what I understand, the majority of those, if not all of them, were not shown to have been vaccinated. So we're seeing a tremendous amount of disease out there. We're also seeing quite a bit of disease in Ohio. Cuyahoga County, Montgomery County, and Hamilton County are the top 3 centers of hospitalizations, and we're seeing just a tremendous amount of activity out there currently. And we're also seeing concomitant infections such as COVID-19, obviously the influenza, RSV, and then bacterial infections such as strep and pneumonia.
Well, we're so glad to have you here so you can, kind of give us a warning what you're doing right now. What are some of those symptoms that we need to look out for?
So common symptoms with influenza include a headache, sore throat, fever, body aches, fatigue, cough, cold, congestion, and those are in many cases common to other illnesses as well.
Right, that's the thing that makes it a little confusing sometimes.
It can be.
Yeah. So who should be concerned about the flu? We hear that babies even at 6 months should get the flu shot. So tell us about that a little bit.
Sure. Everyone should be concerned about the flu, whether it's for themselves or for the people with which they interact. So everyone is susceptible to the flu. We should all get vaccinated. Children 6 months and up should be vaccinated. And quite frankly, an individual can be a vector for disease in the event that they are not the one afflicted. Conceivably, they could pass it on to others. So really, influenza vaccination is for all individuals 6 months and up.
And how can we protect ourselves against the flu? I know there are a number of ways to do that.
There are, and I would say the top 3 are vaccination, followed by vaccination, and again followed by vaccination. However, beyond that, there are some hygiene measures that one could take to reduce the spread of influenza. And some common recommendations would be if an individual is sick, it's best to not attend family functions and large gatherings. It's better to spread joy and not germs, right?
Right.
So stay home if you're sick, number 1. Number 2, if you're sick and you're coughing, sneezing, etc., it's best to cover the mouth with either a Kleenex, sneeze or cough into the elbow, and then frequent and adequate hand washing. And what that means is washing the hands to the tune of happy birthday so that you've washed your hands thoroughly, and teaching the kids to do so as well.
Now, who should get the vaccine? Now, you mentioned that's the best defense, but who should get the vaccine? 6
months and up, ideally.
Yeah,
and there are some other preventive strategies as well in terms of age-appropriate vaccination for bacterial and viral diseases otherwise. Some examples of that would be COVID vaccination and pneumococcal or pneumonia vaccination.
Okay, and when is the best time? Is it ever too late?
It's hard to say that it's ever really too late. We typically start vaccinating in the September timeframe in this area, going through and into the spring, because in this area we can see influenza well into the spring. Ideally, it takes approximately 2 weeks to generate some degree of immunity following vaccination. So the sooner the better. Is it too late? Hard to say, probably not.
Yeah. And how is Buckeye Health really helping to make sure that we are staying healthy this season?
Well, we have a motto at Buckeye Health. We are improving the health of the community one member at a time, and we mean that. Yeah. We're making it incredibly affordable for people to get the vaccine, our members. It's basically free. Yeah. So, and in addition, our members get bonus bucks for preventive health services in addition to vaccination against influenza. So there's multiple benefits to our members.
Well, we appreciate you all. We really do. Thanks so much, Dr.
Pleasure
Kambelos, for keeping us healthy and reminding us how we need to and what we need to do to prevent the flu.
Thank you again.
For more information, you can go to buckeyehealthplan.com/flu, and we will be right back.